After 4 years of this podcast, one truth has become impossible for me to ignore. Metabolic health can't be restored without systems thinking. And nutritional endocrinology provides the lens we've been missing. From the beginning, this podcast wasn't created to collect tips and protocols and quick fixes. It was created for practitioners and health seekers who could already sense something is broken in healthcare and who want a better approach, a better way to think inside that broken system. My goal was and still is to help practitioners think differently, to move beyond symptoms and silos, and to start seeing the body as an interconnected system that's constantly communicating, adapting, and compensating. Over the last 4 years, one thing has become impossible for me to ignore. Even the most intelligent, well-trained practitioners struggle to get consistent results when they're forced to practice inside a system that rewards reductionism instead of reasoning. Blood sugar, hormones, labs, food, genetics, these have always mattered in my work. They are foundational. Now, foundational does not mean sufficient. And what I've seen again and again is that foundational concepts get mistaken for complete solutions. And when that happens, progress stalls. The issue is not that practitioners don't know enough. It's that they're rarely taught how to integrate what they know into a coherent system. That's the gap this podcast exists to fill. That's where nutritional endocrinology comes in. Nutritional endocrinology is a systems-based approach to metabolic health, and it looks at how food, hormones, metabolism, and signaling work together to drive real outcomes. Healthcare needs to be compassionate and systems-based, not this for that. And we need to understand systems if we want to provide the best care possible for our patients and our clients. As we enter the 5th year of Reinvent Healthcare, I want to be very clear about what this podcast is here to do. This podcast is for people who want to understand metabolic health through a nutritional endocrinology lens. It's for people who care about how systems communicate. And it's for those who know that the same intervention can produce very different results in different bodies. Going forward, my solo episodes will focus on sharpening systems-level thinking and clinical reasoning. And guest conversations will serve as real-world illustrations of that thinking in clinical practice. So if you've ever felt frustrated that you're doing everything right and still not seeing the results you expected, this next chapter is for you. Over the next 5 episodes, I'll be laying a clear foundation for how we think about metabolic health through nutritional endocrinology. And if you're new here, those episodes are the best place to start. And thank you for being part of this journey. And welcome to year 5 of Reinvent Healthcare. I'm so glad you're here for what comes next.